So let's talk about GERD, gastric esophageal reflux disease. And generally, it's thought of as too much stomach acid is coming up and irritating your esophagus and your stomach. And that's true. You do have acid that is affecting those tissues, or it could possibly be bile reflux. That's something that gets overlooked. That isn't really considered actually as a cause because the bile, if it refluxes in the wrong direction, it can irritate your esophagus just as much as acid can. But I know most people that are taking the medication, they don't want to. They just don't know what else to do because when they stop taking it, they get all their symptoms back. And so you need a strategy for healing the tissue and figuring out why the condition is, why you have it to begin with, whether it is some sort of an infection, whether it's chronic low grade that we can't find through medical testing, or maybe it is something that can be found, but the medical treatment is not having an impact on it. So, of course, diet, most people have figured out what bothers it, and they start to avoid it. But generally, there needs to be more than that because we want to take away what's irritating, but we also need to actually promote the healing process. And the medication use over time is going to decrease or stop proper protein digestion, and you're not going to absorb your minerals very well. And this whole structure is made up of protein, minerals, and it's insulated with fat, and you fuel it with carbohydrates. So structurally, you've got to have those components. So you do need a strategy for figuring out, is it acid reflux, bile reflux, a combination of both, one or the other? Specifically for you, what kind of foods should you be avoiding based on your immune system response? And do we have a chronic infection that's driving the process, creating some of the inflammation? So I can help design a strategy specifically for you to start to heal the tissue and eliminate any factors that are driving the problem. But I understand why people continue to use the medication because they just don't know how to get off of the medication. But it takes a specific strategy, and it's different for everyone. I wish I could just spiel out, take this, this, and this, and it's all going to be fine. But I don't know that for sure. Bringing you in my office, checking you, and seeing specifically what you need, and taking you step by step through the process is how we break the cycle. But the longer you're on the medication, the harder the process becomes to actually break the cycle.